I wake up at 4:30 and then obviously straight to the bar. Then by 5:30, I have to be out of the house. I can't have breakfast at home because time is running. I catch a taxi there. Sometimes the taxis aren't there. We have to wait for them. So take a taxi. We get to town. Take a taxi from town to here. If there's no traffic, then I get here at like straight 7 o'clock.
Nonhlanhla Kotwane travels to Charlotte Maxeke Hospital 3 times a week for dialysis treatment. She was born with only one kidney and started dialysis at the age of 7. Nonhlanhla is now 27 years old and has had 3 kidney transplants over the last 20 years. But now she's in renal failure. Her kidney does not function properly and her body needs the dialysis machine to help rid her blood of toxins and waste fluid.
Certainly is helpful in keeping people alive. It's called artificial kidney. So what happens is that the blood is removed from the body. It's cleared by a filter, which the machine regulates, and then the cleaned blood is returned back to the person's body.
Nonhlanhla needs to be connected to the machine from 7 to 11 a.m., totaling 4 hours of dialysis. But despite her early mornings and long taxi rides, she's one of the lucky few. South Africa is currently treating just over 6,000 patients with kidney failure, leaving many who need dialysis untreated.
If you look at, say, a really high-income country like Taiwan, there's over 1,000 patients per million of the population who are on dialysis. In South Africa, we are looking at something like 150 per million. And it's estimated that if we look at equivalent economies like Thailand, Malaysia, Brazil, we should be treating at least 3 times our numbers.
We just need machines. Hospitals need machines and more trained staff, because with more machines, you need more staff.
Is it possible to have more satellite dialysis units so that people don't travel so much? If you live in a city or live in a town where there's a dialysis unit, you're okay. Otherwise, you might have to travel sometimes 200 kilometers to go to have hemodialysis on the dialysis machine.
Dialysis is a very costly treatment. The machines themselves are expensive, and then it costs roughly 120,000 rands to treat each patient per year. Because of this, public hospitals throughout the country often have to turn desperately ill patients away.
I just wish more people didn't have to die from renal failure.
In fact, in the last 2 years, our waiting list crisis has become acute. Previously, we were always able to make a plan and take people. So it's actually been a very difficult situation for the doctors and the nurses on the ground, because there are lots of patients who do fulfill the criteria for straight treatment but are unable to have it. A fair number of patients, by the time we can make a slot for them, they're no longer alive. And that's a very sad situation.
Nonhlanhla passes the hours attached to the dialysis machine by reading the newspaper and chatting to the nurses. She is monitored closely and her blood pressure is checked every hour.
I'm not gonna lie, I can't wait to get home. I'm tired. I get so exhausted that I just want to see myself at home.
It's interesting that the motto for World Kidney Day today is kidney health for all. It's basically healthy lifestyle, take care of your kidneys. And that's a simple message in a nutshell. Do what you can to protect your kidneys.
Looking after your kidneys involves drinking lots of water, exercising regularly, and not eating much salt or sugar.
I think in the short term we do need to have some increase in our dialysis facilities so that we are able to offer more treatment to people already in kidney failure.
While Nonhlanhla waits for a kidney transplant, she relies on the dialysis machine to keep her alive.
I mean, all these years, dialysis been keeping me alive. So All that matters is I'm alive, you know.